Hello lovelies, and welcome back to the Bump Project, where I'm going to be sharing with you lots of hopefully really informative advice if you are pregnant or you're looking to get pregnant, to really teach you and to coach you through some of the big changes that are happening in your body, how to navigate those changes and how to stay fit and active during your pregnancy. In today's video, I thought I would go through a little bit more theory around some of those physiological changes that are happening in your body when you actually become pregnant. And I know when I went down the journey of becoming pregnant with Sky, I really started to have to learn a lot about the hormones that actually influence your ovulation and conception and all those other things. Because the journey that we took to fall pregnant with Sky, we did end up needing a little bit of help, and it was absolutely mind-blowing. But once you are actually pregnant, those hormones, all of those hormones, they do end up changing again from that regular cycle that you have as a woman from throughout your menstrual cycle. So I thought today I would really share a bunch of information around some of those amazing hormonal changes that happen in your body, how they influence metabolism, and then also chat a little bit about weight gain that you can expect to happen during pregnancy, as it is a bit of a taboo topic, but I know it's something that a lot of women do stress about, so I thought I would cover that today as well. So let's jump into some of these hormonal changes. Now, first of all, huge disclaimer, I am not an endocrinologist. I know this information from studying various courses and learning along the way, as well as being pregnant and experiencing it myself. All of this information is readily available, but I thought it's a great way to actually recognize some of those changes and the influence those hormones have on your body, so that you can just be a little bit more informed and recognize that yes, feeling poorly, especially in your first trimester, sometimes it is a really healthy sign of a healthy pregnancy, because it means all those hormones are doing the job that they need to be doing, which is to grow your baby and to keep it safe within your uterus. So the first hormone I'm going to talk to you about is the HCG hormone. It is the hormone that we generally test for when we want to work out if we are actually pregnant. It usually starts to become present from, I guess, around 5 to 8 days after conception. It's made by the placenta, and it does actually prevent ovulation. So it's a really important hormone, especially in that first phase. It builds very rapidly in the first few weeks of being pregnant. It generally peaks around 10 to 12 weeks, and then it does drop off, but it remains elevated above your pre-pregnancy levels for the duration of your pregnancy. But it is really important because it does trigger the release of progesterone and estrogen from your ovaries for the remainder of your pregnancy. So let's chat about estrogen and progesterone. So we know that these hormones are really important in terms of your normal cycle, and they normally, with your menstrual cycle, they do cycle around in terms of being elevated and then dropping back down. But they are, and they do remain elevated throughout your pregnancy. And actually estrogen remains 30% or 30 times higher than what it does at your pre-pregnancy level, which is crazy. And estrogen does play a really significant role in a healthy pregnancy. It increases the size of your uterus. It helps with the production or the increased size of your breast tissue, which is obviously important if you are planning to breastfeed your child. It helps to relax the pelvic ligaments, which then tends to soften certain regions of your body, so maybe your sacroiliac joint and also possibly your pubic symphysis joint. So don't forget that it's not just relaxin that sometimes can soften these ligaments, it is also the estrogen as well. So especially if you are finding early on in your pregnancy, first trimester, you're starting to get discomfort in those regions, sometimes it is the estrogen that's actually causing that, not necessarily the relaxin, or it could be a bit of both. Progesterone, however, does increase the contraction of the uterus. It helps to make sure you don't go into early labor. It's important in the early stages of your fetus growth. And it also helps for the lactation as well, so the production of milk. The next hormone is HCS, and this hormone does start to increase around the 5th week of pregnancy, and it plays a very significant role in changing the way that you metabolize food. it actually increases free fatty acid availability for you, so you end up using more fats as fuels. It also decreases your insulin sensitivity. Now, the reason why it does that is it wants your body, the mother's body, to be using less glucose so that there's more glucose available for bubs. And this could be one of those reasons why you start to crave more carbohydrates, because your body starts to use more glucose for that growing fetus. The next one is relaxin, and relaxin you've probably heard a little bit about, but it does help to soften all the ligaments and the tissues to help prepare you for birth. It actually increases in the first trimester and then decreases in the second, but it does play a really important role in helping the pelvis to open up. But if you are a very hypermobile person or very flexible, sometimes it can be that hormone that can trigger quite a lot of inflammation and pain. We are going to be covering topics around sacroiliac joint and pubic symphysis as well later on down the track, so make sure you stay tuned for those episodes. The next hormones are actually hormones linked to the pituitary gland. We have corticotropin, thyrotropin and prolactin, and all of these hormones do increase during pregnancy, while the follicle stimulating hormone and the luteinizing hormone decrease for obvious reasons. If you know anything about the menstrual cycle, they are really important to help stimulate ovary release from your ovaries so that you can have a cycle, and obviously that's just not needed when you are pregnant. The next two hormones are adrenocortical hormones, and these hormones help to mobilize amino acids, which are the building blocks for any cells and muscle tissues within your body, helps to mobilize those amino acids in your body so that it can be creating more building blocks for the baby, because it's obviously wanting to create healthy cells within that growing body. And that's a really important consideration, because recognizing that you do need to make sure throughout your pregnancy that you are continuing to have a diet rich in protein, because the baby is going to be putting extra demands on your amino acids, therefore causing the breakdown of your muscle tissue so it can get more amino acids for its developmental processes that it's going through. So it's really important that you keep up your protein intake throughout pregnancy, although recognizing that inevitably, yes, your muscle mass may drop, but what we don't want to find is that the amino acid breakdown in your body is ending up causing issues around your immune system, which I know definitely with Skylar, I definitely got a lot more sick throughout the pregnancy. Flus and common colds, I was just a lot more susceptible to picking things up. I'm not sure if there is a link there, but do make sure that you keep your protein intake up for obvious reasons. The baby is going to take what it needs, but you've got to be looking after your health as well. So your adrenocortical hormones do actually do something really crazy within your body. They are actually able to stimulate your body to make glucose from non-carbohydrate sources. And it's doing that for a very specific reason. It wants to be making sure that there is more glucose available for your bubs. However, that does also increase your blood glucose levels, and while it's good for the baby, it can be one of those factors that can increase risk of gestational diabetes for you. So make sure you keep that in check, although there is obviously that routine check at the 26-week mark to see what your blood glucose levels are doing. But unfortunately, gestational diabetes is sometimes a side effect of your pregnancy, which generally does resolve itself once bubs. The next hormone is aldosterone, and this hormone does increase the sodium secretion from your kidneys, and that does cause water retention, and especially later on in your pregnancy, you might start to find that you get puffiness or edema in the hands, feet, face. Unfortunately, that is part of being pregnant. Keep up your water intake. However, it can also cause more serious problems of preeclampsia, which is high blood pressure later on, which can be quite dangerous for the baby. So make sure that you continue to get your blood pressure checked up, which I'm sure that your doctor would do. But it is important to note that sometimes that hormone can change the way that your body is processing sodium within the body and cause a little bit more inflammation than normal. Thyroid and your parathyroid. Your thyroid actually grows around 50% larger during pregnancy, which is crazy. Your metabolism also increases as well. So generally speaking, in the first trimester, you'll find that your basal metabolic rate will increase by about 4%, which is probably why you are reaching for more food. by about 10% in the second trimester and 24% in the third. However, there's huge variations in those numbers. So the most important thing is recognize that your metabolism is increasing and recognizing that you might just need to be eating more fuel to be sustaining yourself as well. It is also important to note that the parathyroid, it can increase in size if finding that your body is lacking in calcium. So make sure you keep your calcium intake up during pregnancy so that you can maintain healthy thyroid function. And I do also recommend that after you've had the bubs, that you do get your thyroid levels checked, because it is quite common after having your babies to see that there might be some high or low functioning levels of your thyroid, which can cause issues later on down the track in terms of either weight gain or extreme weight loss. So do get your doctor to check your thyroid levels after you've actually had the baby. And lastly, I do want to chat about weight gain during pregnancy. It is a topic of conversation that does cause quite a lot of anxiety and stress for a newly pregnant lady, because they're worried about putting on all this weight and then possibly not being able to lose it later on. First of all, I just want to normalise that weight gain during pregnancy is completely natural and it is part of a healthy pregnancy. Everyone should be gaining weight during pregnancy because it is part of getting the body ready for actually growing the baby, and there is huge demands that go along with it. In any given pregnancy, the research kind of tells us that you'd expect to gain anywhere between 12 to 16 kilos. Now that does depend on where your weight starts before you are actually pregnant. So if you're underweight, you might gain more. If you're overweight, you might gain less. But the actual baby and the blood volume and all those changes to tissue, that actually only equates to about 5 kilos. So you can expect to gain also some healthy body fat along the way. Now those curves and extra stores, they are really important to help balance out the body, because you've got all this weight growing out the front. You generally find that the body, the way to help keep you nice and balanced, ends up putting more weight around your hips and glutes to make sure you don't topple over, as well as making sure that you've got a plentiful supply of stores, energy stores, to be able to support the baby in its first year of life. And I know that again, it sounds pretty crazy, but that is just the way that the body is designed. We're designed to grow these amazing things. So it is really important to recognise that weight gain during pregnancy is healthy, it's part of the process, go with it. You will also find that in terms of weight gain, it would differ for individuals. So some people might expect to see a very linear weight gain throughout the pregnancy. So they put on a little bit of weight kind of at a very steady pace throughout their pregnancy, or you might find you go through growth spurts. And I guess that's what I found with Sky, that I put on more weight initially in the first trimester, maybe not so much in the second, and then as the bubs continue to grow, I possibly put on more weight in the third trimester. Specifically in that last 4 weeks, I really found that I grew in size. So just recognise that if you're feeling like your body is changing really rapidly, it is completely normal. If you do find, or if you think or if you're worried that you're gaining an excessive amount of body weight that is likely to put you at risk of maybe gestational diabetes or other health complications along the way, chat to your GP. But just remember, habits over calorie counting. Think about ways that you can implement very small habit changes into the foods that you're eating. Try and continue to stay active. But in another video, I'm going to be talking to you more about nutrition and some guidelines that I'd be, encouraging for a healthy pregnancy anyway. So I hope that that's helped. I hope you've enjoyed today's videos, really looking at hormones, metabolism, and all things in between. If you've got any questions, please shoot them through. Otherwise, I can't wait to speak to you soon. Bye.